welcome back to another video. I'm Kieran, that's Tal. We have another special guest, but it's not Sabrita. It is our very own auntie. Auntie Cassandra, say hello to our fans.
Hi guys!
Aunty Cassandra is also a YouTuber for the NJ Family Crew, so go to subscribe to her channel. And today we're going to be interviewing her.
Yes, shout out.
Ready for this.
And
Yep.
if there is words, like really big words that we don't understand, we have our dad's phone to help us. Yeah.
Okay. Let's get this started.
So I'm going to go first. How are you today?
I'm alright.
Okay, my turn
How are
now.
you guys?
Good.
Good.
Okay,
First question.
I'm gonna go. Can I go next?
Yeah.
Okay, you go.
Okay. Is it hard being a parent?
What did you say?
Is it hard being a parent?
Oh my days. Of course it's hard being a parent. You guys are a handful. Remember there's like, each of you have different personalities because I've got 4 kids. So, you got 4 cousins over here and there's 4 different personalities.
You know that.
4 different people to talk to. Just like in your household where there's 3 of you, you must think that mommy and daddy have a hard time sometimes dealing with you guys, isn't it? But it's all love all the way around.
So it must be tough, huh?
It can be hard, but it's rewarding at the end of the day because you guys show us so much love.
Anyways, Tal, are you gonna ask your question?
Yeah. So my first question is, did you always want to be a nurse?
No, I didn't always want to be a nurse. When I was in Jamaica, when I was younger, I wanted to be a bank manager, an air hostess, or an actress. But things and times change. I realized that I don't like heights, so I could not be a air hostess because I don't like heights. I don't like being in planes. I don't like none of that foolishness. Listen, I'm talking to you now. My heart is like because I'm getting scared about it. Now coming into England and then looking after people, like doing care work and stuff like that. And I've realized that I actually like working with people and I actually like old people, young people. I like people in general. So I said, let me try out the whole nursing thing. And so far, I'm happy in the career that I've chosen.
Beep, 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 beep. Okay, I'm going to start doing that when I don't understand a word.
You're going to put your hand up when you don't understand a word?
Yeah, herosis thingy. I don't know what that is.
That sounds like
superhero. You know, other ladies on the not even so ladies, I don't want to be sexist. The people like boys and girls, men and women on the plane that look after us. You know,
the flight attendant.
Yeah, the flight attendant.
Yeah, flight attendant, hair hostess, those type of people. But I don't like heights. I don't. And I still like acting. I always pretend still anyway, so I still am doing a bit of acting.
Can I ask my
haven't made
question now, please?
Yeah. What about you guys? What do you want to be, Kieran, when you grow up? And Talicia?
I want to work also with UNICEF with the retrospecting.
Wow.
I want to be an actress.
That is
Actor. It's an actor.
Oh yeah, actor.
You want to be an actor, Kieran?
Yeah, because
why not? Go for it.
I'm a very good actor because when I can fake cry, really. I can.
Yeah, you do that because you cry.
Do you think you can be a good actor because you do a lot of fake crying?
Yup.
Oh, God.
Okay,
Next question.
My next question, okay. How would you tell someone to love themselves if someone was rude to them?
Very good question.
What? I can't hear you. What did you say?
How would you tell someone to love themselves if someone was rude to them?
How would you tell somebody to love themselves if somebody else was rude to them?
Yep.
Let me me think. How would you tell somebody to love themselves?
This is a tough question, isn't it?
What?
Even for me.
What
Is
are you
it a tough
saying?
question?
That's the question.
Yeah. The question is, how would you tell someone to love themselves if someone was rude to them?
If somebody else was being rude to that person.
Yep.
I'm trying to make sure I understand it. So if I'm being rude to you, yeah, how would I tell myself to love myself, or how would I tell myself to love you? I don't understand it.
I'll
Is it?
explain. So what the question is trying to say, if someone was being bullied, how would you tell them to love themselves no matter what other people say?
Oh, that's what you mean. Oh, it's not, it's just letting that person say, you know, sticks and stones may break your bones, but words you say will never hurt you.
Oh.
So that's the kind of thing that I grew up learning, that I grew up on. So no matter what anybody else says to you, yeah, don't believe it. Just believe in yourself. Know that you were here on this earth for a purpose. Yeah, your mom and dad love you no matter what. So it doesn't matter what somebody else out the road is saying about you. It doesn't matter what the other person is saying about you. You don't have to believe everything that someone says about you that is negative. Just believe in yourself no matter what anybody at all says about you. And just have a little bit of confidence in yourself. If somebody says, oh, your hair is not curly or your hair is not pretty, it doesn't matter. Not everybody's meant to have curly hair and pretty hair. Some of us meant to have short, thick hair. Do you understand? So don't believe everything that everyone else says to you. Just believe in yourself and love yourself for who you are.
That was
So
an
answer the
amazing
question.
response. My turn.
Very amazing.
Okay, so my next question is: as a child, what was your first inspiration to become a nurse? I think that's how I say it.
As a
As
child,
I said, like, I didn't want to be a nurse when I was younger. And what inspired me as a teenager to become a nurse is my mom, because my mom has always done care work. So she's always been looking after people ever since I came to England. So seeing what she has done and the relationship that she's developed with her clients, that has kind of inspired me to say, oh, I want to kind of have that relationship with my clients as well. Because with the work that you do, when you do care work, like as in go into different homes with different people, sometimes you're the only face that they see. From when you go for their morning breakfast, or when you go for their afternoon lunch, or when you go for their evening tea, you're the only person that they see, and they really value your company for the little 10 minutes or the 15 minutes or the half an hour that you're there with them. They really value that, and they're excited to see you. They're excited to tell you how their day was, how their night was, and it's good that people appreciate you. So that's kind of my motivation to do it. Do you have anybody in your life that motivates you guys?
Our parents.
my
Good,
dad.
good.
Our parents, yes.
Yeah, your parents I'm sure they do motivate you
Everyone
guys
I know.
to be the best persons that you can be, isn't
Really,
it?
everyone I know.
Okay.
Everyone you know.
Okay.
Next question.
Oh yeah. What is her? Wait, tell. You do this question.
Okay, I'll do mine. Okay. My last question is, what was it like working on the front line?
Ooh, yeah, that was it was a lot. Like on a more serious note and on a more serious level, like emotionally, it was emotionally draining and it was emotionally frustrating at times. What that means is that, like, you see somebody come into hospital and there is nothing that you can do to help that person, and all you can do is just comfort that person knowing that they're gonna pass away. and there's nothing you can do about it. No matter how much medication you give to them, you can't stop the inevitable. Inevitable means that it's going to happen anyways. You can't stop it. So for me, that was like frustrating, and it was emotionally draining. And sometimes as nurses, we take home our problems in terms of what happens on the wards. It affects us when we leave the ward. So like, for example, if you're looking after a patient for your whole 12-hour shift and that person passes away just as your shift finishes, you know, that can mean a lot. It's hurtful to you, because a lot of times when my patients pass away, I cry. You know, you're not really supposed to cry, but I do cry because I feel sad for them, and I feel sad for their families as well, because remember that person is not coming back, and you gotta put them in a bag and all of these things. Yeah, so the hardest part of me working on the front line was seeing people pass away and knowing that you can do nothing about it.
Very sad.
And tough.
It is very sad. It can be very sad, and at the same time, it can be very rewarding as well, because I've had patients who were basically almost dead, but then we managed to save them. And then when they come down to the ward, on my ward, because I worked on a respiratory ward. Respiratory means obviously anything to do with your airways, your breathing. So they come down to see people like me. And then you know that like 12 hours ago, they were almost dead. And then now they're like coming back to life, and they've got tubes in their throat. They've got tubes in their nose. They've got tubes all over them. And then you're doing everything that you can to help them and to know that they've survived. That's a good thing. Some of the time their hearts have stopped, and we've got to resuscitate them, meaning that we've got, you see on TV when they do CPR, when they pump their chest and then they shock them, so they let their heart start beating again. We've had to do that and bring them back to life, and then they're back to life, and then they get better, and then they leave, and they're grateful for what we've done. Do you think that you guys? You said you want to be an actress and you want to be a philanthropist. So would you want to change it? Maybe you'll change your mind and become nurses.
Can I say something real quick? You should have shocked the people that passed away. You should have shocked them.
No, some people that pass away, they've got a form that is called DNR. So DNR means do not attempt to resuscitate them. So if their heart stops, we cannot try to make their heart start back beating again. We can't try to revive them. If their heart stops, we've got to allow them to go to heaven.
Why?
So because that's what they want. Sometimes before they get really sick, their family or themselves, they sign a form, so that if that happens to them, if they get really, really ill and their heart stops beating, we're not allowed to try and make their heart start back beating again by shocking them or attempting CPR. We can't do it because we'll get into trouble.
I want to ask my final question now. Can I ask my final question?
Yeah, sure.
Okay. What do you love most about being a nurse?
What I love most about being a nurse?
Yes.
Well, I actually because now I've changed my role. I've changed my nurse role. I've just changed my nurse role. You guys know that I'm not in the hospital anymore. So that's good, because I'm not doing the long shifts. I'm doing shorter shifts. So now I'm basically out in the community. So meaning that I'm in the schools. So I come into the schools and I see kids like you, and just chatting to them, knowing what they want to do with themselves before I give them their vaccines, because now I'm a immunization nurse. So basically I give children vaccines with injections and all these things. So it's rewarding because the kids are so always so happy and jovial, and I'm chatting and I'm laughing with them. So that's a good thing why I'm actually liking being a nurse, because I like people.
I have a question. I'm gonna on the top of my head. Have you been through any surgeries before?
Yeah, like personally, or have I actually seen any surgeries?
Seen any surgeries?
Oh yes, yes. I saw. What did I see again? I saw craniopathy. Yeah. So basically, that means it's surgery when they cut the skull open and fix the patient's brain. I've seen that. Yeah, and I've seen open heart surgery as well, when they cut their chest open and they use like what is it called? I don't even remember what the name of it called. It basically opens up the bones in the chest. You see your ribs at the front here, right in your chest hair is called your sternum. This bone right in your chest hair is called your sternum, and they cut that open and they fix your heart. So I've seen those two surgeries.
Okay.
That was brutal.
That was brutal.
Yes.
Oh, that feels
No, it's not brutal. It's to fix them. Remember they need to fix them, right?
Are they unconscious?
If they don't fix them, they're gonna die.
Are they unconscious, or do they just numb the body?
Yeah, they put them under loads and loads and loads and loads and loads of sedatives. Means they put them to sleep. They give them some gas, and they put them to sleep, and then they give them an injection, and they keep them sedated where they can't feel any pain, so they clear asleep. And then there's loads of different types of people around in the operating theaters. There's loads of different people around that do different jobs. So then you have the anesthetist. The anesthetist is the person that gives them the medication to keep them sleeping. That person is very important. He stays at the top of the patient's head, by the patient's head. They stay there. And they have all the other nurses who passes all the different equipment that the doctor needs. And then there's loads of people watching the blood pressure, watching the heart rate. Surgery takes a lot. It's a lot. So when a person goes into theaters and they come out, your mommy went into theater, remember, to have one of you guys. So she had to have a big surgery to have one of you. Who was it? Was it Kieran? I think it was Kieran. Yeah. And the doctor had to cut mommy open and then take Kieran and then stitch her back up. It's big surgery. Doctor put mommy to sleep so that she can take you.
Oh, I didn't know that.
I did not want to.
Yeah, exactly. You didn't want to come out. You made us very scared. You didn't want to come out.
You know what? How about we do a fun question? Nothing about nursing. What is your favorite part of YouTube?
My favorite part of YouTube? Watching other people on YouTube. I like watching other people on YouTube. I don't like watching myself.
Can I say what I want to say now?
I like watching other people. What's your favorite part of YouTube?
I have a fun question. What's your favorite game?
Game.
What's your favorite game?
What's my favorite game?
Yep.
I like game. Like in terms of video game or like outside game?
Outside games.
Oh. There's this thing when I was growing up, it's called Dandy Shandy. If you ask for it, you know what Dandy Shandy is, yeah?
What's
Dandy Shandy is my favorite game. It's no, you guys English people call it Piggy in the Middle, or I think you call Piggy in the Middle. Is that right? When two people are at each end and someone's in the middle and you got a ball?
Yeah.
And you're trying to hit them with a ball? Is that Piggy in the Middle?
Uh-huh.
Yeah, we call it Dandy Shandy Sighting. So that's my favorite game.
Okay.
What's your favorite game?
I don't know.
Roblox.
You like video games. Kieran loves video games. Yeah, exactly.
Okay, I have one more question. Who's the funniest in your house?
Me.
That is true.
Funniest. Am I not?
Yeah, you are.
I'm the funniest. one. So as I said, I might not have made it on TV as an actress, but I've got my audience in my house, so I can always pretend with them. So this is me living my best life with my acting.
Mhm.
Yep.
Yeah, girl, go on. What else do you want to know?
Well, that's it for today. Thank you for your time. Thank you for doing this interview with us. Yeah. Thank you for sharing so much about your life and your nursing career.
Oh, you're welcome, guys.
And she's like a human dictionary now because she used so much big words and then she just explains it so properly. I didn't even need to use a phone.
Is it? Oh,
Uh-huh.
that's good.
We don't even need a dictionary now. We just need Aunty Cassandra. That's what we need. Anyways, that is the end of the video.
Huh?
That's the end of the video.
Yeah, I hope you guys enjoyed the video.
For longer.
Oh, and don't forget to subscribe to NJ Family Crew. They post so much good things. And Aunty Cassandra also does baking, so you can learn from that too.
Oh yeah, that's our next collab, Talicia. With me and you doing some baking and decorating.
Definitely.
Yeah.
Definitely.
Well, lady, that I'm gonna make another Roblox video.
Obviously.
By myself too.
Thank you for watching, guys. Bye.
Bye. Say bye, Aunty
Bye.
Cassandra. Bye.